insurance wasn't diagnosed until it was too late, and left it to her mother to share that story, which I hope becomes a legacy that helps pass health care reform in this country. But this happens far too often and costs all of us more when somebody is uninsured and doesn't have access to preventative care, goes in after the fact and has to have a limb removed because of untreated diabetes or any other condition. It costs us all more. Those costs are passed along to those of us who have insurance, resulting in higher insurance premiums for the rest of us. That is why we need to pass comprehensive health care reform. Thank you, Mr. Speaker.
For what purpose does the gentleman from Colorado rise?
Mr. Speaker, I move that the House do now adjourn.
Question is on the motion to adjourn. Those in favor say aye. Aye. Those opposed, no. The ayes have it. The motion is agreed to. Accordingly, the House stands adjourned until 12:30 p.m. on Monday, next, for morning hour debate.
Caldwell on C-SPAN. This week, the Supreme Court held a special session hearing oral argument on campaign finance. We'll replay it Saturday at 7 p.m. Eastern on C-SPAN's America and the Courts. The session also marked the first appearance on the bench for Justice Sonia Sotomayor. Here's former Justice Sandra Day O'Connor on what it's like to be a woman on the court.
I'm sure that the future will show that we have other women serving on the court. It's hard to be the only woman on the court, which I experienced for about 10 years or so. And in a population which these days produces at least 50% of law school graduates being women, it's realistic to think in terms of a number of women on the court, not just one.
Hear justices during Supreme Court Week as C-SPAN looks at the home to America's highest court, starting October 4th. Anna Edney of Congress Daily joins us on the phone. How is Max Baucus's health care draft being greeted by his fellow committee members and fellow senators?
Well, the draft proposal that he put out it's had a mixed reaction. Some of the more liberal Democrats on the committee, such as Senator Jay Rockefeller and Senator Ron Wyden, have expressed some concerns that they have with it. One of the sticking points is it doesn't have a public option. Instead, it has sort of a co-op system of insurance. So it's tough for those who really think that a public option is the crux of health care reform, that it will drive down costs and bring about competition from the private insurers. They have a hard time accepting that that might not be included in the bill at all.
This Gang of Six, this bipartisan group, has been meeting for several weeks. What's the timetable for Senator Baucus moving through, getting the bill through his committee, the Finance Committee?
Senator Baucus actually said just yesterday that he was going to move forward and have a chairman's mark of the bill ready either early or mid next week, and this is with or without Republican support. He's been trying for several months to get Republican support. He said it's time to move whether he's got it or not. And then he expects to have a markup the week of September 21st, so the following week once it comes out.
How can he move forward if he doesn't have Republican support?
It will be tough for him to move forward. and everyone